Hi everyone, I am Richa Sera, Editor-in-Chief Responsible Hospitals, and today I would like to welcome all of you on our Insta Live session. As you all know that we come up with different topics every week, and again this week is special and we're going to talk about the topic called GERD. So GERD is nothing, it's the related, common language which we call it the gas reflux. And we're going to have Dr. Rakesh Durkure from W. Pratiksha Hospital, having a large experience in bariatric surgery and laparoscopic advanced surgeries. So we'll be talking about gas-related issues there. In case any of you have any questions related to the same topic, I would want you to just put it in the chat box so that we can take up some questions out of the session. So I can see him online. Doctor, I'm just trying to add you. I'm going to send the request right away. Give me a moment. Yeah. I hope you have received the request as I've sent. If not, then please put it in the chat box. Team, are you there? Because I can see him online. Dr. Rakesh, can you hear me? If you're not able to take up the request, you can also send the request to us and we will take up from there. I'll resend it to you on your ID. Guys, in the meantime, in case any of you have any question related to GERD, you can just put it in the chat box. I've resent it. You can just follow the screenshot and probably you will see me live on the session on Responsible Hospital Story. Just click over there and you can just send a request to us. I'll receive it from here. I've tried adding you here. Yeah, just a second. Yeah. Will receive it now. Dr. Rakesh, I've just sent a request to you. You have to accept the request. Yeah, hi. Can you see me and hear me?
Yes.
Yeah. So, Dr. Rakesh, welcome to our Insta Live session at Responsible Hospitals.
Hi, thank you. Thank you for giving this platform, and it would be a very nice interactive session with the people who want to know about this GERD.
Absolutely. So as everybody knows that GERD is a subject which people in their own language would say a gas issue or an acidity, right? They barely understand the importance of it. They may barely understand the reaction and I would say impact on it. So I think I'll take the session one by one with questions and we'll take up some questions from the chat. Initially, we were not taking most of the questions, but a lot of now demand is coming that, please take our questions online. So we have a very limited time of 30 minutes. We'll try to take up as many as possible in between.
All right, great.
So to start with, Doctor, first of all, please clarify what is GERD?
Okay. Now, GERD, as I split the name, it is gastroesophageal reflux diseases. We all know that our food pipe starts from our mouth and goes down up to the tummy where it gets into the big stomach. So this food pipe is called as esophagus and there is a stomach. The pH, that means the acidity of the stomach, is very high, up to 2 or 3 when it digests the food. And in the esophagus, it is all alkaline. So, but when the acid breaks the barrier and comes into the food pipe, which is not normal, that point of the time, the patient feels hyperacidity, belching, or dyspepsia. So we call this whole system as GERD.
Okay. So doctor, do you think, is it normal, because somebody has asked also that, is it normal to have GERD?
No disease is normal, okay? We need to investigate all the diseases till the detail that is it okay, is it a minor disease or a major disease? So our doctor can only tell you whether it is a big or a smaller problem. So if you have any kind of the symptoms, you need to come to the doctor for that.
So what kind of symptoms a person feels and understand that this is the problem and I need to see a doctor now?
Very commonly, if I tell you, the symptoms of GERD are when you had a lot of food, okay, and you feel I am really full till my neck. That is the very easiest and the common symptom of the GERD. So the hyperacidity, you feel there is acid running, your heart burn, and you're
Okay.
just behind your chest bone. You feel it is a heartburn. You feel some kind of lump in your throat. Okay,
Mhm.
sometime in the very severe kind of the symptoms are this, that the patient feels that he is feeling some kind of water brash, मुंह में पानी आना, acidity, खट्टे डकार. So these are the belching, dyspepsia, heartburn, fullness of the tummy. Even after taking a very small amount of the meal, patient feel I'm really full, and then there is a burping starts, and with the burping there is an acid reflux. So that is the
Mhm.
most common symptoms of GERD.
This is what people actually ignore, and they rarely go to the doctor, and they would rather have a pendy at home, rent a at home, to feel that the acidity is a very common thing. It just comes in and goes out once you have the medicine, or else they will try to have this kind of medicine on daily basis. कि खाली पेट एक बार खा लिया and then you are done with 10-15 days. Do you think that's the
Yeah.
right way to actually cure it?
Well, these are the OTC drugs, like over-the-counter drugs, other than the ajwain, which the people have it to reduce their acidity. So what happens that the patient, everyone knows, I even ask to the patients, what is the best choice of anti-acid tablets for you? Because rather than me writing it, everyone will come up with 2 or 3 names, just to know that how
Yeah.
much do they know about the tablets. Even for
Yeah.
the painkillers, I again ask, very frequently patient take and these painkillers or the anti-inflammatory drugs on their own. People take combiflame, few take enzoflame, few take nimesulide, few take paracetamol, few take dolo, Neucoxia. So many of the, you ask them, they know each and every name of the painkiller,
They
which
know
is the
they are
very,
themselves doctors now.
yeah. So for definitely yes, for the initially you can do it for a day or two, but if the symptoms persist, yes, you need to look into the matter and see a doctor.
So how frequently these symptoms occurs? I mean, how do you find that once in a month is okay, once in a week is okay? I mean, how when is the time to see a doctor? Nikki, nahin, this is not okay now. I really need to see a doctor. What do you think?
Like once in a month, it is all right because we are not sticking to the line of our food that we should be having it. So
Mm-hmm.
heavy words, we keep on having the parties, we go out with the friends, have some of the social
Absolutely.
drinks. So that disturbs our normal mucosa. The mucosa means the inner lining of the stomach. So when it disturbs the inner lining of the stomach, it causes the acidity. So once in a month, it is okay. If that acidity is not getting relieved or cured by taking the regular non-fatty, non-oily meals for 2 or 3 days and with the self-medication support of antacids, if it is not getting better in 2 or 3 days, you should come and seek some doctor who, like the gastroenterologist or the gastrosurgeon, who deals more with this disease.
Sure. Somebody has asked that why acidity happens.
Why it happens? A good question. Okay, I've got some kind of a photographs with me to show that
Sure.
that everyone should understand what this is. I hope they can see me.
Yes, yes, they can. It's quite
Okay,
visible.
yeah. So this is our food pipe, and that is our stomach. This blue color that you see over here is the acid. Normally, there is a valve over here. We call it a
Mm-hmm.
lower esophageal sphincter. When the food passes down into the stomach, this valve closes, and the food remains over here for 2 hours, 3 hours, or maybe 4 hours, depending on to its protein content and the type of the food. This acid actually melts it down, destroys the protein part, and then this pyloric sphincter, it opens up and the food passes it lower down into the small intestine.
Mm-hmm.
Now coming back to the question what has been asked to me, that what causes the acidity when you eat different kind of the food which irritates the stomach, it increases the acid. And when this sphincter loosens up, then this acid goes back into the food pipe, like you see over here. This is going up into the food pipe. This causes the hyperacidity, so that you feel the acidity. Yeah, that is the one.
Okay. Sure, I think it's quite clear now.
Yeah.
Somebody's asking, are we over treating gallstone disease? What does it mean? Not
Okay, gallstone's disease. Gallstone is actually a gallbladder. Okay,
gallbladder.
just gallbladder. So just under the stomach, there is a onto the right side there is a liver. Onto the left side there is a stomach. In between there is a small ball of 7 to 8 centimeter in the size, which contains the bile, which stores the bile. It doesn't mix the bile. So because it is stagnant, so many of the stones gets formed into it. Okay. Now, if the stones are troubling you by hyperacidity, by belching or the fullness, then you should get it removed. If they are not troubling you, you can keep them in there in your gallbladder and take you to your grave, no problem. But if they are troubling you, then you should get it removed. Yeah.
And the surgical part is the only cure to it, right?
Yeah. Only cure. It is not like the kidney stones where you drink lots and lots of the water. You don't have to remove the kidney to remove the kidney stones. But yes, you have to remove the gallbladder to remove the gallbladder stone. That's the difference between the two. Yeah.
Sure. Then I've got another question. Dhruv is asking, what are the basic diet changes to follow to avoid GERD?
Okay, I made up quite a lot of the questions. Few, not the like the things which have actually troubled me as well, which actually caused me as also the acidity, and which are the common things. Like one thing is the very late dinner.
Okay.
Yeah, it does not get digested, so the food remains into your stomach for 3 to 4 hours. You have to have finish of the food at least 4 hours before you lie down in your bed.
Okay.
Number one. Number two, do not overfill the stomach. Okay. Number three, avoid fatty meals, oil, fried things, particularly towards the end of the day. Avoid chocolate. Look, I'm not taking away the happiness from the people's life by saying that
Today
don't
is
eat
chocolate day,
chocolate.
by the way. So
Okay. Okay, then let's omit this word from the list. Okay. So then there is a cheese. Then most common, the misnomer drink is the citrus fruit or the lemon juice. People say that I am having a lemon water to relieve my acidity, but actually, lemon is a citrus fruit. Why the name citrus is given to the citrus fruit? Because it belongs to the citric family. Citric family because it contains the citric acid in it. So it again is a kind of acid. But you take it in a aerated water like soda or something, and when it goes inside and the bubble burst of the CO2, the carbon dioxide, and when you burp it out, you feel relieved. But it is not because of that lemon juice that your stomach acid is coming down. लोहा लोहे को काटता है, but ये acid को नहीं काटता है. This citric acid actually increases the acidity more. So one should avoid having the citrus fruits. So these are the things, and then the alcohol, of course, onions, garlic. So these are, and the hot food.
Okay.
Yeah.
Hot food in the sense, hot food in the sense?
Hot food means anything whose temperature is too high. Particularly the very hot coffee, a hot tea, or a hot water, because they don't require a gravity to go down. They go down very fast. The water from your mouth to the food pipe when it enters into the stomach. But when you gulp a food, you at least chew it in your mouth. So its temperature gets down to your body temperature, and then the food goes down. But with the water, it directly goes down and it hits these sphincters. So it relaxes them for a longer period of that, and then the acid gets the time to come back into the food pipe. That's the problem.
Sure, sure, sure. So how a doctor diagnoses this GERD? Is there any process?
Yeah, apart from the aura that we have of how to diagnose the thing, these are the most common things that we diagnose. Number one is by the symptoms. How? Patient will tell you that, after having a small amount of the food, they feel full too much. Then there is a acidity or the heartburn. Then these symptoms they increases when the patient lies down. When you're standing, the food is going down. But when you're lying down, because of the gravity, again the food goes back into the food pipe.
Mm-hmm.
So patient tells you that when they lie down in the bed, then they feel burp or the heartburn increases. Then also the medical tool that we have with us is the upper GI endoscopy. It's a kind of a small camera, the thin one. You put it through the mouth and it goes down into the stomach. It has got a camera at the tip. So we keep on diagnosis whether the lower esophageal sphincters, whether they are loose or normal, whether there is associated hernia or no. Then we go inside the stomach, we look inside what are the signs and symptoms that we see of the acidity. We can see the ulcers also. So that is how we diagnose by the endoscopy. From there we can also pick up some fluid or liquid and check the acid also. We can also check with the manometer. Manometer means a device by which we check the pressure of the valves. So with the
Okay.
pressure of the valve also we get to know that at the relaxed time, how much is the pressure? Is it tight or loose? So these are the two,
So
three.
is
The
this
endoscope.
procedure is painful because I'm sure a lot of people are scared to go for endoscopies and these kind of procedures they don't like actually. Or you put any anesthesia to get
Yeah,
rid of
few
it.
years back, it was very obnoxious kind of the feeling to go and have this endoscopy done. But nowadays, it is done very smoothly. They put a
Mm-hmm.
gag in your mouth and the back of the throat, they spray some kind of anesthesia, local anesthesia. And if the patient
Okay.
is quite anxious, we give a little bit of the small anesthesia for a shorter duration of the time. And the time taken to do this procedure is 3 minutes to 5 minutes. That is it. Quick in, quick out. And we record everything. So, after this thing, we see it onto the screen also to avoid the problem of the patient. But it's a OPD basis thing. Come into the OPD,
Mm-hmm.
get it done in 5, 10, 15 minutes, you can be out of the OPD.
Awesome. That's the easiest
Yeah,
way
yeah,
to
it's
get it actually.
quite quick one. Yeah.
Sure. So another question is, what are the complications people feel when they ignore such problems? I think this is the right platform to know about it because a lot of people actually try ignore such issues and they find it very common and simple. It's okay. It's a part of life.
Yeah, actually, other than the antihypertensive tablets, like the diabetic tablets, people are started carrying these anti-acid tablets also in their pocket.
Mm-hmm.
Like if I am having acidity, I pop in one pill. Again, next day morning, I'll pop in another pill. They keep on continuously, they're having it for years and years. And I
Mm-hmm.
can see, I meet so many of the ladies in the OPD also, like 60, 70-year-old. They are taking painkiller tablets for their joint pain, and because of the acidity, they are taking one anti-acid tablet also for
Yeah.
20 years, for 30 years. They are
Mm-hmm.
taking it. Means
Okay.
that's so nice of them. But actually, what happens? Acidity leads to an ulcer formation, and
That's
when
true.
this ulcer happens in any part of the stomach, when this ulcer happens, how does the body responds to any kind of an injury? If there is a scar onto my skin, it will contract. Same
True.
thing happens. Same thing happens in this kind of a diagram also. Like if any ulcer happens over here, this is called as the pylorus area. Then
Yeah.
this will contract. This will become tight, cicatrize, or hardened up. Then it will not relax when the food want to go out. This can lead to some kind of the cancer in the future also. A chronic insult.
That is
Yeah.
something which should be taken very seriously then.
Absolutely, absolutely. Yeah, so
Yeah.
these things can happen. Your stomach can rupture, your food pipe. We've seen so many of the people who have taken too much of the alcohol. While
Yeah.
vomiting, their food pipe burst out. It also has seen. Yeah. and
Oh,
it
I
can lead
see.
to the hernia formation also, the hiatus hernia. So hiatus
So
hernia
lots of
actually, yeah, a lot of like this is the food pipe when it joins the stomach. From the side of this valve, part of the stomach or something goes up from this side or this side. We call it a hiatus hernia. So for that, a bigger surgery is required for the disease
okay.
which you can deal very well with the doctor's help.
Now, any surgical procedures which are there to cure a very serious problem? What do you think about it?
Well, initially, the surgery is the last stand in the treatment of the GERD because 99.99% of the patient they respond very well with the lifestyle
Medications and
changes,
all.
just the medication, and after consulting the doctor. So 99.9% you don't require certain things. But for the
Okay.
patient when it starts affecting your lifestyle, you're working, like you cannot sit in the office because of the chronic acidity, or it has led to some kind of the hernia formation, then yes, surgical treatment is required. So,
Okay.
as you know that, GERD is actually two problems. One is the chemical problem, one is a mechanical problem. Chemical means acidity is high, mechanical means there is a dysfunction of the valve.
Okay.
So when these chemical and mechanical problem they get together, it is echoregiara kind of symptoms. So they augment each other's attack onto the our stomach. So we need to tackle both the things. So in surgery, what we do, we give some kind of a tablet, syrups, or medication to the patient to calm down the acidity. Number two, we repair the valve. So we tighten up the valve and make another valve around the stomach so that to make it just the unidirectional flow valve. I've got a picture for that also. If you want, I can show it to you.
Sure, sure.
Like, yeah, like this is the stomach. This is normal stomach. Okay. So this is the valve which we tighten up during the surgery. And you see, we move the back part of the stomach, wrap it around this food pipe, and this is, we call it a fundoplication.
Okay.
So we tighten it up. Yeah. So we are creating another valve, tightening the previous valve and creating another one. So this is the mechanical part which we do in the surgery.
Okay.
That is how we deal with it. Yeah.
Somebody is asking that why have I got gallstone?
Why? Okay. Fine. Like in the ladies, it is 4 times more common than the men. Number one. Number two, it is mnemonic in our medical science that gallstone happens in the fat, fertile, fair, female of 40s. Okay, 5F is involved. The fat, fertile, female, fair, 40. Okay. So this is the age group. The middle age group is of the ladies is more common, more prone to this thing. This could be attributed to the number one fatty food that we are having, the oil-rich ones. Number two, the hormone also plays role in it. The female hormone, the estrogens, it plays role in it. Exact hypothesis is not there. Next thing, the stones forms into the water, which is stagnant. You know that. Gradually the moss, the gravel, or then the formation of the stone happens when the water is not flowing. So same happens with the gallbladder also. When the gallbladder is full of bile, it is not emptying from time to time. If you are not having 4 or 5 or 6 times of the meal in a day, and we are doing a longer duration of the fasting every day, like ladies, they generally skip the breakfast because of the overload of the kids, of the husband, or the household thing, or the office, or the other thing. They directly have the late lunch, which is actually their only meal of the day. So now gallbladder is waiting with the full bile since morning till evening to empty it out. So in that stagnant bile, gradually it becomes thicker bile. It becomes like oily, and then a small granules starts forming, and they coalesce to form a bigger stone. So this could be one of the reason.
Sure.
So have regular food to avoid gallstones.
Sure, sure. This is going to be my last question, which is what I'm taking from the online. Is chest pain symptoms of is chest pain is a symptom of GERD? GERD? GERD?
Yeah, like chest pain, the central chest pain, just behind your chest bone, is the symptom of GERD. Other than that, if the patient is also having not like this chest pain can also be because of some kind of the heart attack. So avoid that dangerous disease first, which is slightly onto the left of your body, the left chest. Okay, but in the one which is coming in the center is mostly because of the GERD. Patient also have the bad breath. That
Okay.
also can be because of the GERD, because on the bile, the greenish bile or the yellowish bile, when it is coming into the mouth, it
Mm-hmm.
leads to the bad breath.
Mm-hmm.
If your teeth are getting stained yellow over and again is a symptom of the GERD. If
Okay.
you're having a repeated asthma kind of attack, because over here our food pipe and our windpipe, they both meet over here with, we call it a pharynx. So when the acid comes back into our food pipe, through the food pipe into the mouth, some droplets of it trickles into our windpipe, which can cause repeated coughing, sneezing, cold, asthma kind of breathlessness. They also could be the symptom of GERD, other than the stomach acidity or fullness.
Sure. My last question of the session is something which I think everybody can take up as a learning. How
Mhm.
lifestyle can actually help them to cure such diseases? How should they help themselves through lifestyle
Okay,
changes?
okay. Now, if we stick to the plan of the what has been told to us by our ancestors, then yes, we can avoid the GERD. Getting up timely at of the day, then have the breakfast morning time, better between 7 to 9. Avoid caffeinated drinks as your first drink. Okay, because life runs only with the caffeine. I know that. But yes, avoid it as the first drink. What want to say it. Have food first. Some people drink at least 2 glasses of water. They feel yes, what we have done the best thing of the day is by drinking 2 or 3 glasses early in the morning.
Including me
Now,
also, I do that.
so no, drink water. I'm not saying no, but at least 250 or 300 ml. People drink half a liter and they feel proud in drinking 1 liter in the morning. But then stomach fills up with only the water, and stomach thinks that something is coming down. I need to digest. Stomach pours in the acid. But what does the acid finds? Only the water. Now
True.
the acid starts eating itself. So
Oh,
have the
yes.
correct little amount of the water. Okay. Have a breakfast early in the morning. Try to avoid the oily fried thing throughout the day. Have regular meals throughout the day. Every 4 hourly you should eat something. I'm not saying drinking is regular throughout the day, but eating has to be every 4 hourly, something or the other.
Sure.
Then don't eat or drink after 7 or 8 in the night. Don't. Try to avoid that. Big breakfast, medium lunch, and almost no dinner. That should be the plan.
Having milk is good in the morning, or a lot of people have the habit of having milk in the night. Do you think
Well,
it is good?
in the night is good. Yeah, milk actually it contains milk magnesium, and the calcium component is very good in the milk. So it neutralizes the extra acid which you are having. So people have take it as a drink. So better it is to have it in the night because you're not having too much of the food, and the extra acid will get neutralized by the milk.
Sure. And in the morning, a lot of people have the habit of taking some amla juice, and some people take aloe vera juice.
Yeah, have it. No
So is
problem. No
that
problem.
okay?
Have it. Yeah, that's fine. I
Done.
always think that the allopathic and the Ayurvedic, they both should go together along with the naturopathy to treat all the diseases.
Cool. Fair enough. I think we are almost done with all the questions with the right time frame. Thank you so
Okay.
much, sir. I think it was a
All right.
great pleasure having you here on this
Thank you.
podcast.
Same here.
Thank you.
Thank you.
It was
Thanks a
great
lot.
talking to you. Bye bye.
Yeah. Thanks, man. Okay.